source.
You look so serious in this picture here, ladies. You look like those people looking at that painting. No, I got you laughing. All right, let's talk about something. Lauren Debick is in the studio, and of course you all know Lauren. We're going to talk about minimally invasive surgery, valve surgery, fixing our valves, Robin.
I know, we need that. That's a good thing to have happen.
We'll see the computer's down. Was it down last time you were here? It's still down. Okay. And I'm still not used to it. Lauren is the manager of marketing communications at Ocala Health, and that is why she brings us some really great guests all the time from Ocala Health. Good morning, Lauren.
Good morning. How are you?
I'm pretty good. Pretty good. Ready for Thanksgiving? What do you have to get ready for? See, women always have to get ready. Men just have to eat.
Exactly.
This is a real difference in the sexes, isn't it? Do you think the women who become men just like stop doing that? It's like, okay, I'm a man, I'm done.
I don't think so.
Do you think they say, I was a woman last year, I did the turkey, this year I'm a man, you guys cook it, I'm going to eat?
No, they're not going
No?
to do that.
Is that a politically incorrect? Look at your face. You got nice teeth.
It's a curiosity.
All right.
I know, aren't the ladies beautiful?
Melissa, is it Dessaint?
It is.
Melissa Dessaint is in the studio. She's a registered nurse. Sorry, and the valve coordinator.
Yes,
Wow,
sir.
where'd you get that title? The valve coordinator.
I got lucky, I
Where are the
guess.
valves? Like in your heart? You mean those valves?
Yes, sir.
I have valves. I'm being so silly, and she calls me Sarah. I should just stop.
We're
Just stop.
old.
Just stop
No,
being
not
silly.
all. Okay, I won't call you sir.
So I have valves in my legs that I had to have fixed. In my veins in my legs. I mean,
Arteries, veins.
is that right? Oh,
Probably not valves.
okay.
but-
No. Okay.
No.
I don't
That would
know.
be your-
Lauren, I told you about that, right? Yeah. Lauren knows everything medical about my history. I've shared everything. Well, good morning, Melissa. Nice to have you in the studio.
Thanks for having me.
So this is specifically heart valves, right?
Yes, sir.
How do I know. Can you help me visualize what the valve looks like?
Well, there are 4 valves in the heart, and you have your mitral valve, your aortic valve, pulmonary, and tricuspid valve. The aortic valve is probably the easiest to recognize. Usually it's a tricuspid valve, and it looks almost like the Mercedes-Benz
Nice.
symbol.
Okay.
Some people can generally, when they're born, will be born with what's called a bicuspid valve, where they don't have that third leaflet, and so that's one of the reasons it would lead to possible valve surgery.
So and it's, the purpose it serves is to let blood go one way and not the other way?
Correct.
Okay. And when it doesn't go the other way, that's when surgery. I mean, when it does go the wrong way, right? That's when surgery's needed.
Right. If it pulls and doesn't push all the way through the valve, that's when you would require surgery. Or sometimes if you have a buildup or a narrowing of the valve.
How do they know? How does the doctor know?
Stenosis. There's different testing that can be done to diagnose a valve disease. Obviously, regular checkup with your cardiologist, starting with your primary care physician or cardiologist. They can do echocardiograms.
Really? Mm-hmm. Do they have a clue just by listening with a stethoscope? Does that tell them anything?
Sometimes,
Really?
yes, you can hear a murmur, which is indicative of a valve problem, yes. Not always, but
Okay.
Are there any more outward signs about that if a person feels something's not right, that makes them go to get a doctor's appointment?
so fatigue, shortness of breath, sometimes palpitations, maybe some discomfort in the chest, maybe not necessarily chest pain, but a discomfort in the chest area, a rapid weight gain, any swelling of the abdomen area, feet and ankles. Those are all signs of potential valve disease.
Really?
Oh.
And the thing I had with my legs had to do with swelling in my legs.
Yes.
Yeah, they had that, and the doctors took this wire and they burned out the veins, and now they're dead. And now the good ones are working.
Yes. Yep.
You familiar with all this?
A little bit.
Is there an age limit for valve disease, or can it affect babies on a?
So you can be born with valve disease if the structure doesn't form properly in utero when you're born. You may not have any symptoms until later in life, but it can definitely be a congenital defect. Some lifestyle choices, of course, diet and exercise, because once you have, if you've had a heart attack or any type of coronary artery disease, which is a blockage in the arteries of your heart, that can put you at risk for valve disease as well.
And that's where stents come in?
Stents have to do with coronary artery disease, and sometimes when you have a blockage, you can, your cardiologist could potentially stent that to open that area up. But yes.
That doesn't help the valves. You have something else that you do to fix that.
Right. There is a procedure called a balloon valvuloplasty that they use for stenosis of the valve, where they go in, and it's similar to a where they do the stents. It's a very similar procedure, and the balloon valvuloplasty, basically they get in between that narrowing of the valve, and they inflate essentially a balloon to try and widen that stenotic area or area that's been tightened. It doesn't always work, and you may eventually need to have surgery, but that is one option.
So if we were to talk about this subject 20 years ago, is the procedure different now than it would have been 20 years ago?
So it's a little bit different. 20 years ago, to replace a valve or repair it, the surgeons would do what's called a sternotomy, where they do an incision down the middle of the chest. It's about 6 inches.
Oh, wow.
They go through the breastbone, and they essentially have full access to the heart to be able to repair or replace the valve.
Oh my gosh. What was the thing that they used to do? I remember an actor, like on a talk show, and he had a cow artery or something put in there. Was that what happened? Do they still do that?
They do use what's called a tissue valve that may be grafted from a pig or a cow, but they also use what's called a mechanical valve. There are differences with the two.
Like, is that man-made, mechanical? Mm-hmm. Okay.
Yeah. So what's different now than 20 years ago is minimally invasive surgery. And the surgeons at Ocala Regional Medical Center offer, actually, the largest portion of our valve replacements are done minimally invasive. And what that means is they make a small incision in between your ribs, depending on which valve they're going to do, and that will depend where the incision's located. It's about 2 to 3 inches wide.
Are you awake when that happens?
No.
Oh, okay.
You definitely are not
Thank
awake.
God.
It's the same. It's called minimally invasive because the incision is smaller. It's still a very detailed
Do
surgery.
people ever talk in their sleep? Like when they're out, like, I would be afraid of this. I'd be afraid you'd be, working on me, and I'd be telling you everything.
I think probably when you're getting your anesthesia, you may say some funny things.
What do you hear? Anything good?
He's not at liberty to say.
I could share some stories, but I might get in trouble for that.
Don't say names. You don't say
names.
Well, if I say something, you can say names. I told the lady from hospice that if I'm ever in there, I'm going to be pretending I'm seeing ghosts all the time. It's got to be cool to think that you're actually with somebody who's dying and sees a ghost.
When a person has their heart valves corrected, is that when the pacemaker comes in? Do you insert a pacemaker too, or
No.
How does that? When does a person need a pacemaker?
Well, that doesn't necessarily have anything to do with your valve. That's has to do with the electrical conduction of your heart. That's a different topic.
Oh,
yeah.
Okay.
It's amazing, isn't it, how the whole thing works? It's just amazing. When God created man, what he created, right? And woman. We should change that word. What was that town that took the word men out of everything? There's no
yeah.
more chairman. It's chairperson.
Exactly.
Yeah, that's a good idea. It's not a bad idea,
Yeah,
right?
sure. No, I think it's a good one.
Uh,
What made you really become passionate about this? Because you could
Yeah.
branch out anywhere in the medical field.
I actually, before I became a nurse, was working on a cardiac unit, and my manager at that time, who was my manager for almost 11 years, she was just very passionate about what she did, and she was a good role model to me, and I really tried to learn a lot from her. She just had a lot to offer, and some personal experiences for me in sticking with the cardiac field. So I really enjoy working and doing what I do when it comes to helping people, but especially with the heart.
And how do you help the families? Because sometimes the families are more excited about things than the actual patient, and you've got to do psychological stuff.
There's a lot of psychological process that goes on with taking care of a patient, especially someone who's having surgery. A lot of people are, not too many people show up and say, I'm ready, I want to do this. Like, you do get a few. But there's a lot of anxiety and nervousness that comes along with it. So it's just honestly listening to what people have to say, because what they have to say is important to them, and just helping them work through those fears and helping them realize that it's going to be okay.
So you're the person we go to for the answers, right? We sit with you? No,
You
you're the
could.
coordinator.
Yes.
So does that mean you coordinate us with the doctors, or?
Sometimes, yes. The position is new to me, so I'm still learning the entire role. But essentially, yes. My prior job, my patients would call and ask me to do things that had nothing to do with
You've got a good bedside manner.
their surgeries.
At the radio station.
Oh,
So,
well, thanks.
but I mean, I can tell right from sitting here that I would call you up. I would say, hey, what's going on here? Because I didn't understand a word that he said. It was all Latin.
Yeah.
I didn't understand anything.
Well, and what's really good about our doctors that we have are from our cardiologists to our surgeons to our anesthesiologists. They do spend a lot of time with their patients. I get that a lot from when a patient has surgery that's a pre-planned ordeal. They go for what's called pre-admit testing, and they interact with a lot of different people. And they all have come back to me to say, I really enjoyed my time with Dr. So-and-so. They took their time. They explained everything to me. If they didn't understand,
Really?
they would call me and ask.
That's
and
good to know.
It is good to know, because you don't always get that, but I think this is probably, something that a lot of doctors are realizing they need to take time and spend time with their patients.
Or have somebody like you.
Or that too.
Laura,
yes.
have we met any of the doctors that Melissa works with?
I don't believe so.
No.
Yeah, Dr.
Yeah,
Huang
maybe,
did,
yes.
Who?
Dr. Huang,
Dr. Wang.
he was on.
Oh, yes. Yes.
It's been about a year ago, I think.
Yeah.
When the effective heart valves are replaced, is there any chance of rejection?
You could potentially see future problems with the valve much later down the road, but continuous follow-up with your cardiologist and any testing that they recommend to evaluate that valve function is highly recommended for you to continue seeing your doctor.
And that's who takes care of the surgery, is the cardiologist?
The cardiothoracic surgeon
Oh.
is who does the surgery, and the follow-up after that is with the cardiologist, the heart doctor.
Oh, okay.
This may sound dumb. It does to me. I'm listening to it in my head. How is it attached? How does the valve attach, like an artificial valve attached to the real heart?
They sew it in with
It's sewn in? Mm-hmm. Like with stitches? Mm-hmm. Wow.
And they're permanent stitches. I mean, they don't.
You should see the
go
buttons
anywhere.
Robin put on my shirt. She did such a good job putting the buttons on. I had a shirt with like one button.
Oh, it's my claim to fame. I'm a good button sewer, let me tell you.
We went to the fabric store. But what's this got to do with stitches? And she found the buttons, and then next thing I know, I have my shirt, and I said, wow, this looks like a professional did this.
It's a skill. It's a real skill.
skill that I don't have.
So does the doctor need to have that skill to put the...
Absolutely. It's a very fine skill.
do doctors ever put their own buttons on their shirts? I mean, if they've got the skill, we should ask Dr. Wang this. Who puts the buttons on your shirt? Because you've got the skill to put the heart valve on.
Sure.
What is exactly the thread?
I honestly don't know the answer to that.
What if it's just thread?
No, it's not a thread. It's
No?
it's a surgical suture.
And does the body like adhere to it somehow?
The tissue may grow around it.
So does that mean it's stronger after time?
It could,
Like at
yes.
first?
Well, initially, yes, absolutely. And so, once you have valve surgery, you'll be put on different types of
So
medication.
it's gotta be easy. Gotta go easy. No smoking, no lifting people and things like that.
That's right.
And drinking too, right? I mean, you advise against any kind of alcohol?
A little bit of fun is always good in moderation, but not.
Oh.
I wouldn't say none.
I'm putting that on a t-shirt.
I wouldn't say none, but I'm not a doctor, so all things are good in moderation, and a healthy lifestyle with a healthy diet, active lifestyle. As long as you're able to do those things physically, and a lot of people who end up having a valve disease, they physically may not be able to do those things until they've.
Do they know it
had
themselves?
surgery.
Or do they feel like, oh my gosh, I feel like $1 million. I can go out now and chop down a tree. They feel that way, but they're not that way.
Well, right. Everyone is different. And so I've seen patients who come in and they have all the symptoms in the book. And I've seen patients who the only way, we found out they had valve disease was by doing different testing, maybe due to age or one thing
Really?
led to another. And they're like, I feel great, but your numbers show this, and so you might feel great, but eventually you're gonna
Do you know what's strange about age? I'm older now than I was when I first met you.
Yeah.
That's a crazy, it's unrelentless. Just keep getting older.
Every day.
If you, go ahead, I'm sorry.
Oh, no, I was just wondering if do you need any kind of therapy after you have the surgery? Does it weaken anything?
Well, anytime you have surgery, I forget, there's a quote about when you're in the hospital, for the amount of time you're in the hospital, you lose a certain amount of muscle mass. So anytime you're hospitalized, you decondition kind of quickly. With valve surgery and bypass surgery, we send our patients for what's called cardiac rehab. It's a rehab program built specifically to rehab patients who've had valve surgery or bypass surgery, and they follow specific guidelines for that. So yes, there is a program for that.
Melissa Dessaint is who you're listening to. She's the guest of Lauren Debick, who's sitting quietly behind her. And if you ladies will put your headsets on, you'll be able to hear a caller. Make sure you can hear me first. The veterans couldn't hear me earlier. Can you hear me? Okay. Good morning. Thank you for calling in, for waiting. You're on the air.
Yes, thank you, and hello, ladies.
Good morning.
Say, as part of your routine checkups, at what age would you recommend a person to start taking a stress test?
That would be dependent upon your past medical history, and your cardiologist or primary care physician could probably better help you with that answer. I'm not quite sure that a stress test would show that there's a valve issue, but I'm not 100% on that.
All right. Thank you. Let's see if I can squeeze another one here. Oh, they disappeared. Call back, whoever that was. Just 622-9622 if you want to call. So if you don't have a answer, if we don't answer all the questions, why is it so hollow sounding all of a sudden? Oh, it's the phone. Okay. Can they call you, like, at any time?
Yes, I do have a contact number that, I'm sorry, these headphones are...
They're crazy? We do have another phone call, though, so you'll have to...
I had there we go. Okay, I got it. Sorry. Yes, I do have a contact number that I can leave with you guys.
Okay. Can you announce it
I absolutely can.
for
It's
the video?
Sure. It's
Because it's recorded, and then people will have it for
fantastic.
future. Your friends and family will all watch.
Oh, I'm so excited.
They will say, that guy was so rude to you, wasn't he?
Not at all.
They're going to say, that guy was talking about his shirt, and you were talking about a heart. Am I right, Lauren? Yeah.
It's okay.
I get it all the time.
So I can be reached at 352-401-1267.
Okay. We do have a phone call. Good morning. You're on the air with Melissa.
Yeah, good morning. Larry was talking about buttons and shirts. I have a sewing story.
Uh-oh.
It's actually a knitting story. there was a mathematics professor at Florida State, Professor Paul Dirac, and he was sort of like the personality of Sheldon on The Big Bang Theory. And he was one afternoon watching his wife knitting. Now, he knows nothing about knitting, but he's watching her manipulate the needles, and mathematically he's worked out that there's another way to manipulate the needles. And he's very excited, and he says, you know, there's another way to do that. And she says, yes, we call it purling.
Wow. Okay. Thank you. Appreciate the call. Now we know. Well, so this is a serious topic, isn't it? We want to make sure we live.
So when the patient is all ready and you've already got them scheduled for heart valve
Thank God
surgery,
for Robin.
you have
See that, Lawrence?
all of the
She's so
instruments
good.
and everything all laid out, and the thread is the thread a different diameter depending on the age of the patient?
Oh yeah, it's gotta be
That-
big for me.
Yeah, that would be. I honestly don't know. That would be a great question for one of the surgeons, or possibly a scrub tech. I honestly don't know. I think probably yes. There are different sizes for the medical term is suture.
Oh, okay.
And not, well, thread, I mean, is what you use to sew his button on.
Yeah, but suture is for
Right.
the medical procedures. Well,
Yeah.
that's you're really amazing, because I couldn't do what you do, and you've really
No.
got people's lives in your hands when you do things like this, and you really are to be admired.
Oh, well, thank you. I don't do anything. I just help facilitate.
Yeah, but you're part of it, and you see. I'm sure you have some sad stories too, right? People that didn't quite work.
Sure.
Yeah. Mm-hmm. If it's me that doesn't work on, I'm going to pretend I see an angel just before I die. And you're never going to know if they really did or if I was just joking. Just before I go, I'm going to say, Mary?
When you talk to the patient, how long do they stay in the hospital before the operation actually commences?
Generally, with the surgery, they come to the hospital the morning of their surgery, and then the average length of stay is about 3 to 5 days.
Oh, okay. And then how do you know when they're ready to go home to be released?
The surgeons and doctors, the PAs, they see the patients every day. They're monitored very closely, making sure that, their lab values are coming back, blood pressure is looking good. You're up and walking the next day.
Oh my. Is there a soreness there too? And
Sometimes, yeah. I mean, everyone associates with pain very differently, but there is definitely some soreness. I mean, especially if the traditional method is done. I mean, you have to consider that they're going through the breastbone here, and while there's no feeling with the bone itself, a lot of people end up having the most of their pain from their chest tubes after the surgery. Everyone has chest tubes to help facilitate with any drainage. I mean,
Oh, gosh.
yeah. So that's usually where most of the pain
Sounds
is.
horrible.
Well, I don't think it's fun. I've not
But
experienced
are
it.
you able to
personally.
see, like, if somebody has a healthy diet? You know how they say if you're eating a lot of fat, it'll build up in your arteries. Can you see that literally or physically?
When the cardiologist does a catheterization,
Yeah.
they use dye for that.
Yeah.
If there's any blockages, you won't see the dye go through that area. So, yeah,
And is that from what we eat?
sometimes.
Yeah. Mm-hmm. Are you a vegetarian?
I am not.
No?
No.
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 carnivores.
Yes. Had steak last night.
Do you see, does this happen to a lot of sports figures? Because, I mean, the contact sports, like boxing and football, or is this something that everybody's...
I don't think it's specific to one gender or,
Profession.
lifestyle choice or anything like that. I think, it's just, unfortunately, it can happen to anyone.
But the healthier we eat, the less likely we will need this type of surgery.
Yeah.
So if somebody said to me, I need valve surgery, I would first panic, right? Oh my gosh, I need valve surgery. And then you say it's minimally invasive. Then I'll say, oh, Okay, that's not too bad.
And
right?
a lot of that's a reaction that we get a lot of times.
So is that the way you tell it? You need valve surgery. Oh, it's minimally invasive. Oh, good.
Typically, we're not the ones telling them they need valve surgery.
Oh, really?
Thankfully, it's the cardiologist, and then they come our way, so they've already gotten the news.
Oh, so they come to you because
They need the surgery.
okay.
So the general practitioner, when you go for your physical, they'll work everything up, and then if they see something wrong, they'll refer you to the cardiologist. Then the cardiologist will refer them to you.
Correct.
Oh, okay. I love that because you've got a lot of people that have hands-on for your best interests at heart.
Well, the general practitioner is great because they really have a scope. They oversee everything. When there's a specialized issue, they'll send you to a specialist, a heart specialist, a lung specialist, a GI specialist.
It's amazing, really.
It is. And so these guys are trained specifically for whatever their specialty practice is. And then our guys are highly trained and specialized in heart surgery and lung surgery. But with the minimally invasive surgery, that's additional training that not everyone has, and not every facility offers that minimally invasive. So it's very appealing to a lot of patients to obviously have minimally invasive surgery. The recovery time is shorter.
Minimally,
Yeah.
And that's what Ocala Health is. Ocala Health has always been cutting edge for everything.
Yes.
Cutting. That's good. Minimally invasive cutting edge. Minimally. You know where we're going on Sunday? New York.
Oh, nice.
Taking a train.
Oh,
That's very cool.
See, look at her face. Look at her face. Ooh.
my kids would love that.
Oh, good.
You wouldn't.
See that?
I
What?
might. How
What?
long is that trip?
Oh, I was going to say, how long is the train? The trip is 22 hours.
Yeah.
Yeah.
Look
but
at the
you don't
face.
have to drive.
But we're flying back.
Car to car.
Oh, okay.
It's minimally invasive. We're just taking the train part of the way, or half of the way. I have one word to say, by the way: purling. Purling.
I'm gonna have to look that up.
And Lauren, if people are like worried about things and they don't have a general physician or anybody they can go to right now, how can they get in touch with you guys?
They can call 1-800-530-1188. We have registered nurses on staff 24/7 to answer any of their healthcare questions and give physician referrals.
And please note, they are more serious than we are when we do a radio interview.
Yeah, they're wonderful.
Very
Ocala
serious.
Health.
Yes, you guys are awesome. Thank you, Lauren. Have a great Thanksgiving.
Thank you.
Right?
Thank you for having us.
We will see you. Melissa, nice to meet you.
Likewise, thank you.
Hopefully it was fun, right? Was it fun?
Absolutely.
Good. And now you know I have a new, well, I don't have a new shirt, but I have new buttons.
You do.
It's like new. It's
And
like,
I know who I'm going to ask to sew my buttons on. I know where to come.
thank you, ladies.
Thank you.
We'll be right back.
I'm a deputy.
I'm an artist.
I'm a bookworm.
We are blood donors.
No matter what defines you, being a blood donor with Life South makes you a local lifesaver. When you donate with Life South, your blood stays in your community to help patients in local hospitals. Make being a blood donor part of your identity. Be a local lifesaver. Donate blood with Life South today. Visit lifesouth.org for locations.
Gene Powell Pasture Mowing, 629-2440. In addition to our pasture mowing service, we also offer fence row spraying and stump grinding services. Now is the perfect time to get ahead on your weed control and to take care of those troublesome stumps for an overall pleasing appearance. Gene Powell Pasture Mowing, 629-2440, or online at powellgene@yahoo.com. We are licensed and insured. Gene Powell Pasture Mowing, 629-2440.
The most trusted name in news, Fox News, every half hour, only on 96.3 FM, 1370 AM, The Source.
Attention passengers for Flight 1370. The plane has been delayed at its departure point and will be at least 2 hours late. We apologize for any inconvenience.
Are you serious? It took us over an hour to get here, 2 hours going through security and getting our tickets, and now we have to wait another 2 hours.
Yeah, it's beautiful here, but we're inside this overcrowded airport all day because the plane is stuck in bad weather.
This is the last time we ever do this. When we get back, we're going to Ocala Aviation and getting our pilot's license.
Yeah, we've been talking about that long enough. It's about time we did it. Then we could just fly ourselves and never have to deal with this mess again. again.
Right. No long lines, no full body groping security, no baggage checks.
Not to mention never losing your luggage. Remind me again why we haven't done that?
Well, we're idiots.
Oh, right.
Attention all passengers for Flight 1370. It looks like the plane is going to be delayed a little bit longer. The airline has lost the pilot's luggage. Isn't it time you got your pilot's license? Call Ocala Aviation today. 352-861-7484. That's 352-861-7484. Hey, you've earned it. Call today.
Here are today's headlines from the source, WOCA. In the aftermath of Hurricane Irma and 14 deaths at a nursing home in Broward, Democrats in the Florida legislature are pushing for tougher regulation in the industry.
State Senator Gary Farmer says what happened at the Hollywood Hills Rehab Center should never be allowed again.
These are supposed to be special needs and special nursing care facilities. They're not supposed to be death warehouses. And unfortunately, I fear that our elderly have become nothing more than a commodity, and we need to change that.
Farmer wants granny cams in patient rooms so relatives can check up on them, more safety training for staff, report cards for nursing homes. And he says the medical examiner should investigate any death at a home on a state or federal watch list to see if they died of natural causes or negligence. Rick Flagg, Tallahassee.
Florida U.S. Senator Bill Nelson has looked at the Senate tax plan which guts the Affordable Care Act to pay for tax cuts. He says there's no way to spin this into a good idea.
We're going to take the economic underpinning out of it that's going to cause 13 million people, as stated by the authorities, 13 million people are going to lose their coverage and premiums are going to go up. What did CBO say? 10% a year.
He says the vast bulk of the tax cuts this measure touts all go to the largest corporations and not to the middle class. Those skimmers placed on gasoline pumps to steal your credit card information are getting more sophisticated. Detective Spencer Hubble says the new generation uses Bluetooth to send the data to the crooks. They can actually put them inside the pump, and you would never even know it.
You can buy a gas pump key for a couple dollars on there that might fit some generic if a gas station is not using its own specific locks.
Detective Spencer Hubble with the Pasco County Sheriff's Office says they can even buy stickers to put on the pump saying it's secure. His team just finished a joint investigation with the State Department of Agriculture and found 5 skimmers at gas stations in Dade City, Zephyr Hills, and Land O'Lakes. The Tampa Police Department has released new video of a person Police Chief Brian Dugan is calling